Recording.
Hello, my name is Belinda Duncan. I'm a registered nurse, been a nurse for over 35 years. My expertise is in the critical care areas, predominantly in the emergency room. For years I have done nothing but treat patients, and upon discharge we did patient teaching. Patient teaching, usually when it's given in the emergency room, they acknowledge that they receive it and that they understand it, but in all actuality they walk out of the door and they do not remember one thing that you just said. So my friend and I have decided that we could do a major community service by doing patient teaching, and hence we developed our own business, and it's called Renew, and it's Renew Health Training Center. We both have received instruction and certification as health training coordinators, so we are like totally maxed out for accreditations and the ability to train the public in healthcare matters. This is our goal, to help people learn about their health problems, to help them, to train them in areas that they're deficient in, to do what the doctor charges them for and never does. He never explains about anything. You get a prescription, you're supposed to take it, see in 6 months, and say your blood pressure medicine that you just got started on is filled. You start taking your medicine, and in the next few days you have no idea why you cannot walk straight. You keep having episodes of dizziness, and you call the doctor and they say, well, the next time we can get you into the office it'll be another 3 weeks. Where if I was your healthcare trainer coach, you could call me and tell me what's going on. We could check your blood pressure, and that would be the number one thing I would want to do, is check your blood pressure, because in all likelihood the medicine he just put you on is way too strong for you and the dose needs to be cut. Theoretically, we are not allowed to tell you to cut your dose. In this instance, we would have to tell you to contact your physician and actually let them tell you to cut your dose. But we just saved you 3 weeks of wait time because they couldn't get you into the office for them to be able to tell you this. And rather than you take the risk of continuing the medication that he prescribed and you being symptomatic with it because it's too strong, we just cut to the chase. You call me, I tell you what's probably the case, we check your blood pressure, and I tell you what to tell him. He tells you what he wants to do with the medicine. There's a lot of things we can do for you. My expertise, I have developed a weight control program. I have researched all sorts of drugs, prescription drugs, over-the-counter medications, herbals. I like herbals. My partner and I both are into anything that you can do to get off a chemical drug, replace it with an herbal compound. That's what you need to do. Herbal medications are just so much more tolerable by the body. They're a whole lot more affordable, and they do the same work that these high dollar meds that they're prescribing do. I just got off a medication that the doctor had prescribed for me for my blood pressure. After all these years, I finally started getting symptomatic due to having hypertension. and the medication he put me on was way too high. I cut the dose. And then I found this other medication. I was also put on cholesterol medicines, and I found a herbal compound on the internet through a physician who specializes in herbal products that he came up with that works wonders for me, and I have since gotten several people I know on the same herbal compound. I pay for my own medications. Today, the insurance companies are not going to cover any kind of herbal supplement that you can get on the internet, but still, it's worth the effort. To me, it's worth getting off a chemical compound that's made in a pharmaceutical setting to replace it with something that's a safer product for me to be on, with a whole lot less side effects. In fact, there are no side effects for me to be afraid of, and what I'm on is working for me. Let us help you with your problems. Whatever it is, we are here for you. We want to be utilized. It could be set up to for a flat fee. We'll answer a question. If you want us to be on your beck and call, we could set up a fee for that service. If you want to do just weight control program, there's a fee for just the weight control program. We also do basic life support. We are both certified instructors, and we offer classes at your convenience. We'll do individuals, we'll do groups, we'll do businesses. Our facility or yours. We accommodate the community's needs. We want the community to be more informed about how to save a life, how to give an individual just those few extra minutes that it takes for EMS to show up. If you learn these basic few steps and procedures to do, you could actually save a life. You could be somebody's hero. You could give them that help that they need while you're waiting for 911 to show up. Other services that we offer, CNA class. I always forgot about the CNA class. I knew there was something else I needed to talk about here. We're getting certified by the state. It's still pending at this time, but we've got everything set up to start pending the state certification. But we're offering certification as a nursing assistant, and as soon as we get the state approval, we'll have that going. So anybody that's interested in becoming a nursing assistant, certified nursing assistant, we would love for you to contact us, get the application started, get everything processed, so that once we get our certification by the state, we will start our classes. The unique thing about our classes versus everybody else, we have a flat fee, covers everything, no hidden cost, even includes the state processing fee for you to take the state test. We buy your uniform, everything is provided for you to be able to walk into a clinical setting, do your 3 days on the floor training, do your state test, and you've got yourself a career in the healthcare business, which is probably the most stable thing that anybody could get into right now. Healthcare is not going to go away. And that about wraps up everything we wanted to say.
Get a number in there.
My phone number is 713-516-4317.